It is a pleasure to be here, although I am frustrated by the reason that we have to be here. Since the Dobbs decision overturned Roe versus Wade, we have seen reproductive freedom under attack all across the country, from anti-abortion Republican legislators, judges, and advocacy groups. And again, you just have to look at the recent decision in Alabama and the chaotic, devastating effect that it has had on access to in vitro fertilization in that state and potentially in others. I want to come at it from a more personal perspective. When I was a state legislator, I became the first member of the House of Delegates in Virginia to be pregnant while in office 14 years ago. And as a policymaker who was also pregnant, I came to see how these anti-choice laws can impact the doctor-patient relationship. There are a wide variety of reasons why someone would need a particular type of contraception or even access to contraception, not only to prevent pregnancy, but for other healthcare reasons. In my 20s, I needed contraception to treat debilitating ovarian cysts. In my late 40s, after my daughter and I almost died in childbirth, I needed to go back on contraception. And because I was close to 50, my doctor recommended that I go from a hormonal contraception, the pill, to an IUD, because the older you get, the more the chances of negative side effects. That was a decision I made in consultation with my doctor. The idea that my insurance company could deny me access to the specific contraception that we believe is best for me blows my mind and frankly infuriates me. And that is why we have filed this letter with the members of the Democratic Women's Caucus have submitted this letter to ensure that the insurance companies are complying with the ACA's mandate. It is a requirement of law, not a suggestion, that they cover the prescription, the contraception prescription that a patient and their provider feel meets their specific needs. This is particularly important as we have seen, just as access to abortion care and reproductive freedom is under attack, so too is the increase in maternal deaths, particularly among Black and brown women and low-income women and women in rural communities. That is not an accident. That is a direct result of the attack on reproductive freedom that we have seen, and that can be a direct result of an insurance company inserting their views for those of a medical professional and a patient. And that is unacceptable. So we are here to call on the insurance companies to follow the law.